Hi everyone, welcome to the second in our series of panel discussions. Today we're talking about mental health and wellbeing, and we're joined by a panel of experts from the University of Exeter Medical School and also external. And today you can ask your questions. We've got some questions here. I've got quite a lot of questions to get through to start with that people have submitted in advance, so thank you very much for that. But you can also submit your questions throughout the event by just typing into the chat box, and I will attempt to pick up as many as possible and put them to the different members of our panel. If you have any technical problems, don't worry too much because we are recording this, so there will be a recording afterwards available for you, and we will send that out to everyone who's registered. So with that, if I can just hand over to you, Clive, to kick us off.
Thank you very much, Emma, and thank you everyone for joining us. I think this is a really important topic, so it's great that you can join us to have this discussion. And what we're going to try and do is give a very brief introduction of everyone, and then we'll get straight to some questions and hopefully make it as interactive as we can with this format. I'll ask everyone to introduce themselves shortly, but I'm Clive Ballard. I'm Dean of the Medical School at the University of Exeter, and by background I'm a psychiatrist specialising in mental health in older people, and particularly in dementia and related mental health considerations. I mean, obviously we all know that the impact of COVID has been enormous, not just on physical health, but on mental health, not just for people who've had COVID, but all of the impact of people isolating, being disconnected from families, disconnected from their activities, perhaps losing jobs, financial impacts. There've been a huge number of impacts. And this goes right across the kind of age spectrum. So for younger people, for example, young people coming to university, something we've been focusing a lot, and we'll, I think, pick up in some of the questions, the stresses on their mental health and how we can best deal with that. People in midlife have perhaps been most affected by some of the financial considerations. And then obviously older people who've been even more isolated for even longer, people who have caring responsibilities, individuals with dementia stuck at home are perhaps some groups that we've also got particularly high needs, and we've been focusing on with some of our efforts and our research. So to coincide with World Mental Health Day last Saturday, we were holding this event to think about these challenges and how to respond to them. Great to get your feedback on what you see as the sort of key questions and things that we can think about. We have a great panel today covering expertise across the age range and across some very vulnerable groups. So hopefully that will lead us to some vibrant conversation in response to your questions. And I think what we really want to do is both kind of is talk a little bit about some of the things that we're already thinking and doing, but also, great to get your input about the really pressing things that we really need to tackle. We've had quite a few questions submitted already. So what perhaps we'll do is I'll ask everyone to briefly introduce themselves on the panel. And then we'll perhaps take the first few questions that have already been submitted, and then please feel free to submit your questions and we'll get to as many of them as we possibly can. So perhaps if I ask everyone to introduce themselves, just in the order everyone's on the screen. I mean, Emma, do you want to start?
Hi, so I'm Emma, and I'm just going to be looking after you guys today. If you've got any questions, just pop them in the chat, and I will be asking our panel of experts. So, Linda, would you like to kick us off?
Hello, everyone. I'm Linda Clare. I'm Professor of Clinical Psychology of Aging and Dementia in the University of Exeter Medical School. And so my research focuses on well-being in people with dementia and the family members who support and care for them. Rohit.
Hello, everyone. My name is Rohit Shankar. I'm a consultant psychiatrist working in Cornwall. My area of specialism is intellectual disabilities, especially developmental disabilities, including intellectual disability, autism, etc.
Laura?
I'm Laura Fleming. I'm the director of the European Centre for Environment and Human Health in the University of Exeter Medical School down in Cornwall. I'm a physician and epidemiologist, and my areas of interest are the risks and benefits from interacting with natural environments.
Ed?
Hi, I'm Ed Watkins. I'm a professor of clinical psychology in the School of Psychology here at Exeter, and my expertise is in the treatment and prevention of anxiety and depression.
Excellent. Thank you, everyone. So I think that gives us a a little bit of a steer on kind of, the breadth of expertise we have between us. So Emma, do you want to perhaps read out the first few of the questions, and then we can make a start?
Brilliant. So the first question we've had is around universities, really. So for many students, lockdown has given students a really difficult start to their university lives. What can universities do to help them deal with their anxieties and get the most out of their time? Ed, can I come to you first with that one because of your research?
Yeah, sure. I think first of all, we need to make sure that any approach is a whole university approach, so it's integrated through all aspects of the university, not just the formal systems that we have in terms of support services and well-being. And I would see there's 4 kind of core elements to that. So first of all is communication. We know there's a lot of confusion and uncertainty. So clear communications within the university is going to be really important for students, avoiding ambiguity, so they know what's happening and when and why. And a key message within that, I think probably the key message, is the idea that it's understandable and it's normal and it's healthy to feel a bit stressed and put out by what's happening at the moment, because these are unprecedented events and times. And we know that students, have a process of a transition and an adjustment, particularly first years when they first arrive at university. And of course, all of that's going to be exaggerated with COVID and all the changes that have been happening. So we need to get that message across. And that feeds into the second thing, which is compassion. So I think we need to have a compassionate campus where all levels of the systems and structures and interactions are there to support and encourage students, and that ranges from interactions with tutors all the way through to our actual, wellbeing services where we can provide actual interventions. And then the third thing that actually needs to build off that is connection. We know that students are going to be isolated to some degree, not socializing in the same way as before. So we need to have processes and means by which they can feel a sense of belonging to the university, get in contact with other students and with staff. And that means, I think, on a staff level, we need to be a bit more proactive about reaching out to provide that support to students so that they know people are there and are trying to help them. And then the final point, I think, is about how to build a sense of control. So that's how you really cope with difficult situations and you feel you've got some agency and some ability to do things. And that's why it's important that where we can, we try and keep a regular timetable. We keep the ability for students to do their academic work and to learn and to gather from that. But also on top of that, there might be things that universities can do to help build the personal skills that help people feel in control, whether that's online resources to support self-help, apps, access to support services, could even be building into our curriculum and into our teaching elements about promoting well-being and building resilience. And these are all ideas that fit within that wider mantra of a compassionate campus.
Brilliant, thank
so
you.
just to briefly add to that, I think this is an area we've really been focused on. I think it's really exciting. We're looking to develop some exciting programs. I mean, Ed is leading a program to survey the mental health of our students more systematically, so we can really understand what the needs are and really help with the planning. And we're looking very actively going forward at ways of particularly augmenting the digital elements of support, both for well-being and for delivering specific first-line mental health interventions, and then linking it into our well-being services. So I think this is Ed's done an awful lot of work on this area, and I think this is something that we're really trying to push forward as we see as absolutely vital.
Yeah, and just to add to that, I mean, we're literally this week launching a study of apps to promote well-being in students. Okay. So there'll be a place for students to go and access an app at a website, www.mymoodcoach.com. So,
okay, brilliant. We'll share that in the when we send around the link at the end. We'll send that link as well. And a slightly different subject that we were asked about, which is we've heard a lot about the benefits of nature and being outdoors in maintaining mental well-being, but how much impact can this really have on an individual? So Laura, you're in charge of the European Centre for Environment and Human Health, so would you like to take that one on?
Yes, although I'll note that the research I'm going to be talking about is done by many, many people in the center and beyond. So I don't want to take credit for this, but over the last 10 years, we've really developed a body of research ourselves and our colleagues that show in lots of different ways that interacting with natural environments, especially high quality natural environments, is good for both your physical, in terms of physical activity, physical health, and your mental well-being. And I think if there's any good news story from COVID, it is that a lot of people now appreciate the natural environment. So there's actually a people and nature survey that's done in terms of the UK and other places, which shows that now 89% of people in the UK think that the natural environment is good for them. And we have the data to show that. And we've also done some studies now looking at places like Spain, where there was different types of lockdowns. And what is interesting is that people not only talk about their mental health in terms of actually interacting with natural environments, but even just a view can make a difference to their mental health. And we've also done some work using things like virtual reality for people that can't get into the natural environment. So for example, people in care homes or people who are disabled. So I think the good news story about all of this is that in the long run, maybe we will all appreciate our natural environments more and put more resources into protecting them. I think there's a lot of work to be done in terms of access, and people in urban areas, particularly poorer people, often have very little access to this impact, and also not as high quality. So I think there's a big piece of work to be done there. And I think that's enough just to begin with. But yes, the natural environment, if we protect it, is a place that will help all of our mental health and physical well-being.
Can I add something?
Of course, Ed.
So, I mean, one of the areas that I study is people getting caught up in worry and rumination. So getting caught up in dwelling on negative things. One of the things we found is really helpful for getting people out of that state is getting them immersed and absorbed in some activity. And that could be a range of things, often creative. But one of the things that does come up a lot in that space is nature. So going for a walk, going to the beach, looking at the trees. So that, I mean, that does fit very neatly with what Laura's just been saying.
And I'll just add one more thing, not to complicate this, but we have an 18 country survey that we've done looking at people's interactions, particularly with blue environments. And one thing we're about to publish that's very interesting is that people who are allegedly diagnosed with either anxiety or depression disorder actually report interacting a lot with blue and green environments. And they respond to it very positively, per their report, unless they're forced to do it. So if you force an anxious or a depressed person to interact with natural environments, they're not happy. They need to be able to do it themselves. So I think that's also an interesting message in terms of things like social prescribing. But yeah, thank you, Ed.
Definitely. Now, a different topic again, this one's quite specific, that statistically men are often reluctant to seek support for their mental health, and the suicide rates in the UK, and particularly in the Southwest where we are very concerning. What can be done to tackle this? I mean, Rohit, that sounds like your kind of area of expertise. Do you want to take that one?
Yeah, I mean, it's quite right that men are at higher risk, especially young working class men, or young to middle-aged working class men. I guess as in the Southwest, there are multiple reasons. You can broadly divide them into health reasons and socioeconomic reasons. What's actually a bit galling is that only 25% of people who have taken their own lives are known to health services. So that leaves a big ocean of people who are out there who are at high risk. And we need to remember that suicide is almost the end game of a very few. It's in an iceberg of mental health. So when we think about actually suicide prevention strategies, we actually need to think about what everybody else in this panel is talking about and encompassing it from bottom up, where we need to be thinking about things like capable communities. And these capable communities will be different for something like London, Birmingham, Manchester to something like Cornwall, where the communities are much more rural. We are one of the most deprived areas. Southwest is deprived. I mean, it's very beautiful, but underneath it, there's a lot of festering bubbles. And I think the rurality, the economic issues, the fact that there is a lot of ignorance, there is almost a stereotypical behavior that sort of macho image of working class men. And all these things require some sort of unpicking, mainly that people should be able to talk about stuff. And that's where the initiatives locally, what has been taking ground in communities is to actually help develop community resilience towards these issues. And in Devon, I know that there have been neighborhood watches, which have been about watch your neighbor, following the same neighborhood watch model around criminal issues and things. It's very much the same around mental health. In Cornwall, we have projects like Don't Flush Your Life Away, where it is all right for men to talk about their health problems, almost like pub talk, share it, don't pack it up. And for this, we have been using some quirky methodology, things like it takes balls to talk. No man is an island in his own water. So it's that sort of thing where people can appeal to it. And when they do need it, they can actually come and they can access resources. I guess there have been also issues about where we have done phone-ins, where people are encouraged to sort of call anonymously or otherwise to share their thoughts, because sharing, I think, means that there is caring. That's the way I would put it as. And yeah, I mean, it's all about creating capable communities, especially rural, especially now when people are lonely, isolated, and looking inwards, and they're worried for their families and friends. But I think the most important message to remember is that one life which is lost to suicide affects 5 to 50 other people lifelong. Nobody is the same. Everyone lives with that guilt. And I think that is a message that which people need to carry. And even in the darkest moment, it's important that people reach out and share, because there is help out there.
Thank you.
Just to I mean, I think as Rohit says, you know, the Southwest is a high risk area. There's a lot of people think of it as a, you know, a kind of posh tourist area, but underneath that, there's a lot of deprived areas. So I think that's important. But I think it's particularly timely at the moment, because what we know from other pandemics and from COVID is that there's about a 30% increase in suicide rates. So I think it makes it particularly timely to really try and do something about this now, and particularly that connectivity, and to reach out to people.
Brilliant, thank you. And question 4 is again talking around young people. We know that the pandemic has had a major impact on the lives of all young people. What would you recommend as most effective strategies for them to cope with the situation and feel positive about the future, given that they can't do anything at the moment? Ed, can I come back to you with that, given your research in the university?
Yeah, sure. I mean, I think there's a lot of effective strategies that we know work for people in terms of building well-being, promoting mental health, building resilience to difficulties. And I could list a lot, but I'll focus on a couple of core ones. And one way of trying to remember them is a mnemonic, which is SPARK. So SPARK stands for specific, plan, action, routine, and kind. So if I take each of those briefly in turn. So be specific. When we face difficulties, it's easy when we're thinking about them to we can either problem solve them, or we can get stuck and start worrying, ruminating, overgeneralizing, getting it out of proportion. And if you start thinking about the meanings and the consequences and the implications of things, it's easy for it to get out of context and spiral. Whereas if you stay with the detail and the specific, what happened, how did it happen, where did it happen, what did I do, what could I do next, those kinds of questions, it's much easier to problem solve and to keep it into perspective. So that's be specific. Related to that is planning. So a way of getting control is to make a plan, to follow through the plan, starting by breaking down what you need to do into smaller steps, being specific again about when, where, how, who you're going to do those plans. All of those things will give agency and purpose and feeling of getting on top of things. That then leads into action, being active. So we've heard about being active in nature as something that might be good for people's mood. Being physically active is good for mood. Being socially active, being mentally active, being creative, building those things in, but also just tackling problems. It's very easy when you're feeling stressed to put things off. And we know that in the long run, that can make things worse. So being active in that sense. Routine, we know that having a good routine, having some regular habits really helps to give you ballast, to stabilize mood and to feel less anxious and stressed. And the core elements there are things like regular meal times, and particularly for young people, getting into good habits about when they go to bed and when they get up, because if your sleep that gets disrupted, everything else starts to go after that. And then finally, be kind. So being kind to yourself, that's partly normalizing, you know, this is a difficult situation. It's okay to feel upset, but also encouraging and supporting yourself, recognizing when you're doing things well, but also being kind to others and being able to pass that forwards. So SPARK, that would be the recommendation for strategies that people can use.
Thanks, Ed. And now moving on to different age group question. Many older people have had to isolate during the pandemic, including from their own family in some cases. What do we know about the toll that this has taken on this group of people? I mean, Clive, you specialise in this area. Do you want to kick us off?
One of the things that we've been running from Exeter is a platform called Protect, which we can give a link to at the end. And as a quick sort of advert for that, if anyone who's on the call is over 50 and wants to join, then please do and help us with the research. But at the moment, we have 25,000 people over 50 that have been, we do annual assessments. We offer other kind of studies looking at interventions and things as well. And it's mainly focusing on both mental health and cognitive health and assessing that over a period. And one of the things we've been able to do as part of that is add in a sort of COVID mental health tracker, which has been part of what's been informing Public Health England in their strategies around mental health. And what we've seen and we've got a lot of long-term information about people, so we know this is a change for those individuals. We've seen about a 25% increase in the number of people with depression and anxiety over the COVID period compared to the pre-COVID period, which is perhaps not surprising, but I think it's important to be able to identify that. And it's different in different age groups. It seems to be that in the people who are between 50 and 65, a lot of that additional anxiety and depression is related to financial pressures. In people over 65, it seems to be much more related to, in particular, loneliness, but also kind of lack of access to a reduction in their amount of physical activity and exercise, and perhaps that also links into the outside environment. So those seem to be the sort of key drivers of it, and I think have given us some, some important focus about how we can begin to tackle that. We already have a program for cognitive training on the platform, which we've shown benefits people from a cognitive health point of view, but interestingly, it also helps improve mood, and that's come out very clearly from one of the recent studies that we've just been evaluating. And we're also very shortly going to be launching a program to help people with self-directed physical exercise, to try and make that enjoyable and fun, but to try and improve people's levels of activity. And we're also working with King's College London and a group in America to pull together what they've called a resilience intervention, but it's really a sort of small group support network for peer support, problem solving and planning, which hopefully connects people, but also, addresses some of the issues that Ed was talking about for younger people, about how you begin to sort of solve some of those problems. So I think we have seen an increase. I think we're monitoring that. And I think what we're trying to do is hopefully begin to, at least in a small way, try and do something about that.
Yeah, thanks, Clive. And I've got another question here, which I can also see is kind of come up a little bit in the chat as well, which is, what about people with dementia and Alzheimer's? And what are your main concerns about the impact for this particular group of people? I mean, Linda, that's one of your specialist areas. Are you happy to answer that?
Yes, I am. And so as part of our Alzheimer's Society Centre of Excellence, where we're following people with dementia and their families over time, we've been interviewing people with dementia and carers about their experiences during the pandemic. So we've been getting quite a picture of what's happening for them. And these are people living in their own homes in the community. And so there are three things I'd pick up on really based on what they've told us. The first thing to say is the reduction or the loss of social contact has had a massive impact. I mean, it's hard for all of us, but it's much more so for people with dementia, where often things like touch and physical connection become more important than they are even for the rest of us. I mean, for people with more severe dementia, they may not be able to fully understand or remember why it's happening. And and of course, we've all seen in the press some cases where people in care homes just seem to have more or less given up because their relatives aren't coming to see them anymore. But people with mild to moderate dementia have varied. Some of them have been incredibly resourceful. They've adapted really well. They've learned, for example, to meet up online with groups and engage that way, but they still miss the human contact. And others have struggled much more with the effects of isolation, and particularly those who are living alone, of course. One thing that's helped people a lot, and everyone has mentioned this where they've had it, is the just checking phone calls, where someone just calls you every so often on the phone to see how you are. That might be perhaps if you've been involved in a group of some kind, a peer group, the organizer of the group or the facilitator may have been doing that, or staff from local voluntary sector organizations such as Alzheimer's Society. And those calls are a real lifeline for people under these circumstances. So it's been really, really important. And the second thing I'd pick up on, kind of connected to that really, is that the loss of social contact and activities outside the home and the different things that people normally do means that people with dementia have been telling us they feel they're losing their everyday skills, and their families corroborate that. And it's through lack of use. And they feel that that's accelerating the decline that happens over time with dementia. So they're losing skills really unnecessarily. And some have been saying they'd like reablement or rehabilitation now to help them recoup those losses. And we know from our research that we can help with that. That's one of the things we do, and we know how to do if the resources are there. The third thing I'd say is it's particularly hard, I guess. I mean, we've all probably experienced confusion in some guidelines and some of the things we are or aren't supposed to or allowed to do. But it's especially hard for people with dementia to take in and understand information about risk and how to manage it and remember what to do. I mean, we, from our programme, tried to address that a bit by providing some tailored advice in the form of leaflets and web pages. But one thing that's come out particularly in our research is that people with dementia and their families feel they need clear, straightforward, personalised advice about what they should do that took account of their individual situation. And ideally from a health professional they already know and trust. And this is something that people haven't had and have really missed, I think, and it's left them in quite a quandary sometimes about what to do. So yeah, I think there's been a lot of, I mean, these are just a few of the points, really, perhaps the main things that people have told us, but it's certainly had a major impact. We've seen, as I said, people who are really struggling, as well as people who are resourceful and resilient and able to cope.
Brilliant, thank you.
Just to add a couple of brief things. One is that there was some interesting research that came out of Cambridge looking at mortality figures and comparing a period during COVID with a similar period last year. And what they showed was that actually there was a 50% increase in death rates in people with dementia unrelated to COVID compared to the same time last year. So actually there's far more deaths unrelated to COVID, physically COVID infections than to COVID itself. And again, you know, how we get that system of support right so that we're not actually leading to, you know, those detrimental impacts for people is really important. The other thing I just wanted to briefly say is over the last 10 years, we've been running a care home training program called WELD, which helps develop skills in care staff and support care staff to provide better person-centered care, person-centered activities, you know, increase the sort of activities and enjoyable things that people with dementia are doing in care homes. And that's had a positive impact on well-being and mental health for people with dementia. And we now have funding from the MRC as part of the COVID response to roll this program out in a more digital format with virtual coaching. So we're just in the process of developing those resources, and that will be going live to about almost 1,300 care homes over the next couple of months.
Yeah, thank you. Well, that links quite nicely into my next question, which was actually about carers. We were asked that, you know, there's been lots of reports on the news that lockdown has been really difficult for carers, and how can we best support them, especially if they can't go out or access their usual support services that they would have done. So Linda, do you want to kick us off with that?
Yeah, absolutely. I mean, it's certainly been a very challenging time for carers. And again, I suppose I pick up on three things in particular that come to mind from what carers have told us. I mean, first of all, social contact is crucial. We know from our research that carers of people with dementia experience massively higher rates of loneliness than the general population of the same age. So they're already struggling, and then we have this lockdown and restriction on top. So social contact is absolutely crucial for maintaining mental health in whatever form that can be managed. The just checking phone calls I mentioned have been a lifeline for many carers. So that's perhaps an area that could be expanded on. Some carers find it helpful to join things like telephone friendship services if they can't get out. Age UK has one, for example. Some might benefit from support to get online if they're not online already, and connect in that way. So I think that's the first thing to say. The second is that carers need time and space to focus on their own well-being and their own needs. And that's always difficult, but it's more difficult when, for example, you're caring for someone with dementia who's not able to go out and do their usual activities, or to go to a lunch club or a day centre, or go for respite to a care home, because that's now a risky place to be. So, so I think there needs to be some perhaps creative thinking about how we can develop new forms of respite to support carers. Maybe overnight stays within support bubbles, or visits to other people's homes within support bubbles, and physically distanced daycare in outdoor spaces, perhaps out in nature, because we know that, just to pick up on the nature theme, those families and individuals who were able to get out into a garden during lockdown were the ones who were coping much better. The ones who were not coping well also did not have access to outside space, and that was a very common theme. I suppose the third thing to say about carers is that there are specialist organisations that offer support over the phone, and I really always encourage carers to reach out to those. For example, Together in Dementia Every Day or Carers UK, or where the relationship is becoming really fraught because people are together all the time and the behavioural issues get difficult, more difficult to manage, then there is advice, specialist advice from Alzheimer's Society or Dementia UK. But we know as well that not all carers are able to or ready to access those kinds of things. And we do need to be thinking about how we direct information and support through existing networks like community groups and faith groups, especially to reach carers from minority ethnic communities or carers who are digitally excluded. So I think there's a lot more work to be done with carer support in the next phase. And I'm really pleased that we saw today that it's been announced that carers of someone in a care home now in England can be classed as key workers and get a test and go and visit, because I think that's going to be very valuable all round. Yeah.
Brilliant, thank you. I'll just move on to a different topic that we've been asked about, and again I've seen some in the chat about this, which is workplaces. What can be done by large organisations to proactively support the mental health of their most vulnerable employees, such as those on temporary or casual employment contracts, where they may not have been offered furlough and protection and have lost significant income, as well as potentially a sense of personal belonging to that organisation? I mean, Laura, you've done some work with mental health and workplaces, if I could start with you.
And I don't think I'm going to solve this issue. I think one issue is being very upfront about what people, where they can get support, but also that there is a problem here. And part of it is systemic and part of it is peculiar to the particular organization. I mean, for example, where I work at the European Center, one of the things we've tried to do is, even if people, for example, their contracts end, to encourage them to keep interacting with us, to look for resources for them, as well as constantly bringing up the resources that people like Ed have already described within the organization and also outside, as Linda has also described. I think the huge issue here, which has been mentioned repeatedly, is the social contact piece. And that I think there's a whole area now of all of us exploring new ways to interact socially that is both safe and also productive. And one thing that I'm very interested in, for example, is how do you keep social cohesion when you have things where your only interactions are through video conferencing, which is so intentional. And yet a lot of social cohesion is about us being physically in the same place, or at least not mandated to do something at a particular time. So I guess I would point to the fact that you try to keep people involved and feeling like they have a support and membership. You try to signpost resources both in the institution and outside. And also, to a certain extent, keeping up with all this amazing research that's coming out driven by COVID that will hopefully highlight other things that people can do both for themselves and for others and within communities.
Yeah, thanks, Laura. I've just got a couple more advanced questions. One is, I've seen various reports suggesting that COVID may damage the brain, and would be interested to know the panel's views on this concern. So Rohit, given your professional position at the moment, can I start with you?
Yes, I think that's an interesting question for which there is no specific answer as such. But what is being found out has been that there are neuropsychiatric and psychiatric implications for COVID. What we don't know exactly is, are the primary implications, or are they implications of pre-existing illness which is getting dialed up, or are they secondary implications? There's been studies. Recently, there was a paper in Lancet, and that highlighted that it looked at around 140 people. It's one of the largest studies, though it's such small numbers, who have had post-COVID psychiatric and neuropsychiatric sequel, including stroke, including mental health problems. It's quite a sort of large range of various different presenting symptoms. So we can't exactly nail down that X or Y happens because of COVID or likely to happen in psychiatric issues. But what we do know is there's been a recent paper in the World Psychiatric Association journal, which highlighted that people who have been known to have a mental disorder are twice the risk of succumbing to COVID than those who don't. So that's quite stark. And especially if they have depression, things like schizophrenia, and there is actually population-based samples, and this is quite a good study which has looked into that. So mental health, psychiatric issues, neuropsychiatric issues go hand in glove with COVID, one way or the other. We don't know which way the causality works, but clearly the associations require respect and require consideration. So that's important, I feel. It's still early days on that.
Brilliant, thanks, Rohit.
Just to add slightly to that, and I think, I mean, that's a very helpful update, Rohit, thank you. And I guess, but I think that focuses largely, particularly in that 140 people, on people who've had more severe COVID and been in hospital. And it does look like there are, you know, as Rohit said, it's difficult to understand exactly what, but it looks like there are some impacts. I think the other bit that will be very important to try and understand is if there are more subtle long-term impacts in people who've had less severe COVID at home. And, you know, there's a number of mechanisms related to COVID, such as all the inflammation that happens, for example, that might cause long-term effects. So I think as well as those more dramatic effects for people who've had very severe COVID, it'll also be important to try and understand, you know, are there other implications we need to be aware of, plan for in people who've had milder episodes.
Go ahead, Laura.
I just wanted to add also, going back to Rohit's very discussion about the impacts, for example, of suicide. I mean, I think the other thing we have to look at in the long run is the impacts on a particular family or community of COVID. And it's, you know, it's both its emotional and not only just its physical impact. So I think there's a huge piece of research to be done there as well.
Thank you. And just finally, I mean, this question sort of in parts, but really it's, I'm interested in your views about how to best formulate or conceptualize COVID-related emotional versus mental health issues, because the formulation has such a big impact on what you then decide to do. The national story has been, for example, that all frontline health workers will suffer PTSD and moral injuries requiring years of specialist help to overcome damage done to people's self-confidence. So I guess, Rohit, I'll come back to you to start, but I expect a lot of people have views on that. How do you differentiate between emotional versus mental health, COVID-related mental health?
I think it's a tough one. I think at the end of the day, the feelings which people feel are pretty much the same. But I think mental disorder would be sort of something which would sustain over a long period of time and cause incapacity, huge issues with quality of life, and also have major life-changing experience. That's the way I would see it as. Emotional, I mean, we are all going through some emotional turbulence, wherever we are, however we are, some for better, some for worse. And I guess that's dependent upon our own relatives, our family. There's so many connectivity issues here, which are there. And that once COVID's gone, it well might go away. So that's there. So communication, social cohesion, things which were mentioned here are so important. But in a very rudimentary way, I would just like to take it through like a SWOT analysis. So the strengths of something like this. I mean, we've been through wars. We've been through other pandemics. Humanity has come through it. Whether we like it or not, we have to come through it. And I think we are in the best place in one way to confront something like COVID. And the amount of research that's happening, which was talked about, is mind-boggling. Even the communication, I mean, think of it in a way that ecological impact, the positive impact of us doing this and not gathering together in one room, traveling 100 miles to Exeter, there are some positives there. Then the weaknesses are obviously there, because I think the trauma, which the collective trauma to communities, to individuals, is going to sustain. People who have seen deaths will live with that. That's scary. We don't know what the effect of it. Opportunities are there. Maybe this might be the warning call to actually make some difference with regard to global warming and ecological changes. We might be more empathetic and sympathetic to that. And I guess there are threats in the fact that this might be first of many such issues. So let's actually try to develop that resilience in community, but be compassionate and sympathetic to those who struggle to do so or getting overwhelmed. So that would be my sort of broad wishy-washy formulation in a way. So that.
Brilliant, thanks, Rohit.
I suppose if you lead that on to what you're going to do about it, I mean, I would agree with Rohit. In a way, it's a sort of continuum. You know, at one extreme of it, it's obviously sort of some relatively minor, you know, emotional impact of COVID. At the other extreme, there are some very clear severe mental health conditions. You know, in the middle, it is a bit of a continuum, and there are grey areas between it. But in terms of what you would do about it at the sort of lower end of that continuum, I think a lot of the approaches would be very similar. You know, people will have health-related anxieties. We have approaches that can effectively, you know, help and support people deal with that. You know, people's lack of physical activity, their connectivity to other people, their peer support, loneliness, all of those are the things that are contributing both to well-being and mental health. So I think a lot of the solutions would be the same at that end of the spectrum. You know, at the other end of the spectrum, we clearly need to be able to better respond to people with severe mental health conditions, whether that's severe depression, you know, people who are at suicide risk because of the way that it's impacted them. And as in the question, you know, frontline staff who've seen sort of been traumatized by what they've seen. And, you know, I think the same might apply to social care staff in care homes with big outbreaks as well. And there might be, you know, a proportion of those individuals who would have post-traumatic stress disorder, and we'd need to recognize that and support those individuals appropriately. And not every, you know, we all respond differently to different things. And even individuals who've been exposed to really extreme traumas, not everyone develops post-traumatic stress under those circumstances, but obviously a significant proportion do. And we need to be able to, you know, target the right support to the right individuals.
Thanks. Laura, you had something.
I mean, as an American, I've been really impressed during COVID about, for the first time, people in the UK are talking about their feelings as a group, as a nation. And I think there's been permission to sort of talk about the fact that, you know, feelings matter, and that all of the things that we've been talking about are legitimate, and that there are ways to deal with it, like you've heard from Ed and from Linda and Clive and Rohit. And so I actually have a very positive view. I think this could lead to societal changes where we are much more open to the fact that everyone can have mental health issues at different times in their lives, and that there are ways to deal with this, and maybe a more generous spirit on the part of all of us towards this in the future.
Brilliant, thank you.
So that's what happens if you close pubs. Men have to deal with their mental health issues and well-being.
Oh dear. Right, I'm just going to go to some of the chat and go through a couple of questions. So there's been a few questions around school and education. So, you know, specifically any advice for schools, should they be following the same principles as universities, obviously with younger students, but also I'll just sort of throw this in as well, which was people with autism and other conditions might find it difficult to take part in things like this, you know, an online webinar, a Zoom chat, that kind of thing. Is there any support that can be provided for people with those kinds of conditions? So Ed, are you happy to take that on to start with?
I can try. I mean, it's not my area of specific expertise. I mean, I think the same principles apply in schools as they do elsewhere. I think the difference in schools, of course, is that when we work in universities and we're trying to build well-being, it's a combination of staff helping students and direct messaging to students and guidance for students. When you move to schools, then it's obviously teachers, but it's also parents that need to be involved. So I think the same kind of messaging about what could be helpful, how to manage it, the same kind of more passionate approach to things that Laura was talking about. I think, you know, that needs to be extended just more widely into schools and help parents with that, and finding ways to support parents and teachers. So I think all the principles are the same. It's just the application is going to differ slightly depending on the context. I think in terms of autism spectrum disorder and autism spectrum issues, it's really, I think I can't say much specifically because it's not my area of expertise, but it's clear that all the things we've talked about could be helpful, but they are going to be trickier for the reasons that have been mentioned, because there's going to be idiosyncratic differences in what people are comfortable doing in terms of reaching out. Obviously, I've talked about routine as being really important, and routine becomes something really, really important in autism, but and any disruption to it can be very difficult. And of course, we've all had our routines massively disrupted by the pandemic. So I without pushing beyond my professional expertise, I think that's what I can say on that.
I mean, Rohit, is there anything you'd like to add around autism?
Yeah, I mean, I think Ed made some very good points there. Just to actually add, one of the things, there's some good news and some not so good news with regard to autism. So obviously, autism comes loaded with the fact that there's multiple comorbidity. So what you do have is people with autism are highly likely to have other mental health issues or physical health issues, which then makes them a bit more vulnerable. So there is a lot of anxiety and stress already on top of what they're having, which they have to counter. But structure is very important. And what we have also seen some really good stories where stress has been taken off because the environmental stress of being, say, the red bus coming instead of a green bus is gone, and people have a structure and outcomes have been good. There has been challenges with regard to delivery of care, especially with social care, where social care has been hit badly, and that has led to some terrible stories where people haven't received the support, and families and carer stress has gone up through the roof trying to look after people who have significant needs. So in some senses, I think, yes, people with autistic people might find it challenging, but there are societies like the National Autistic Society, Autistica are a very proactive group. Again, they are there. NHS England has come up with some advice around issues around that. We have put together a new paper on what the guidance is around what people want and how that should be received. So that's going to come in a week or two in the BJ Psych Open. So there is things which are happening across the board.
Brilliant. Thank you very much, Rohit. Now, I've got another question here around Alzheimer's. How do we help families with Alzheimer's try to understand the societal changes? And the example is mother should be isolating, but has Alzheimer's and goes out at least twice a day. I mean, Linda, I don't know if you've got any advice there around for carers, people that.
Yeah, I think this is going to depend on whether the person is living alone or with someone else. So strategy is going to be very different. I'm not sure how well it would work, but for someone living alone, we would typically try to work with them to have a strategy to remember. So that might be something in the environment, like a prompt in the environment, prompt by the door, saying stay home, as simple as that. And we would try to work with them to make sure that was something that they recognized and maybe involve them in preparing it and so on. Of course, it's all much more difficult when you can't go into the home and do that work with them, but it's something that perhaps family members, if they're able to visit, might be able to do with some guidance. And obviously, living with someone, there is more of a challenge of rather perhaps repetitive questions and then distress when you're becoming essentially an enforcer of lockdown. And so there, I think the challenge is a little bit different. It's perhaps more about distraction and having a whole set of activities ready to engage someone in that would shift them from a desire to do one thing that is unsafe to a desire to do something that's safe. I mean, these are big challenges for carers, and it's essentially a very full-time job. So I don't want to underestimate the challenge. And I know that when you've been caring for a while, you can feel as if you've tried everything and nothing's going to work. And I think maybe there are perhaps some resources that could help online. We know that we are looking at putting some of these self-help resources together in our research on rehabilitation and enabling people. I think that that really perhaps sometimes for carers to talk to someone else about it, and maybe one of those advice lines that we mentioned, because what we often find when we go is carers say, well, I've tried everything, it doesn't work. And our practitioners really have to get into that conversation and start to look at what has been tried, where has it gone wrong, and then maybe perhaps if you tried it slightly differently this way, it would work a bit better. And so it's very much a working together to try to figure out what the right strategy is. And that way you can often get around more problems than you might think. But it is a challenge. I agree.
Yeah, thanks a lot, Linda. And another question about working from home. What's the panel's view on the longer term effects of working from home rather than in the office, which we were all doing at the moment because of the pandemic? And what can be done to get companies to balance well-being against the savings of closing offices was the question. Laura, do you have anything on that?
Well, I'm sure we all have personal feelings about this. And I think the University of Exeter, for example, is really trying to look at this. And as Rohit has already mentioned, there is a bigger picture here, which is the potential, for example, for decreasing our carbon imprints, et cetera. I think the work that has to be done going forward is, if we really are going to expect many people to work at home, those who have jobs that are able to do that, and that is somewhat of a luxurious position, is to make sure that the work environment at home really is conducive to work. And I've had colleagues where, like, you know, there's children bouncing off the walls, there's cats, and they're in the middle of the kitchen. So that's clearly not a good work environment. I also think there's been a lot of research about how to make a work environment healthy. So there's, you know, if you can do it, have occupational health, evaluate just even the physicality of the workplace in terms of ergonomics. There is some research coming out now that if you have plants and if you can't get outside to green and blue environments, bringing it inside is really useful. And then going back to some of the stuff that Ed was talking about having routines and clear demarcations between what is work and what isn't. And then the last piece, and again, I think this is a real work in progress that we've already talked about, is, so how do you maintain social cohesion? How do you create spaces for people to interact creatively and not directed all the time? I think those, for me, that's the big challenge. And we know that there are these huge companies like Google that have done this for years. So are there lessons that we can be learning from some of these larger companies that have been doing this over the long term? And I guess the last thing I would point out is I've really been impressed at the University of Exeter that the emphasis has been on each individual. In other words, working at home and how people do that has to be right for each individual, and it has to change, be able to change over time, because it will.
Yeah, thanks.
And I suppose the other, you know, well, certainly from a university perspective, you know, the other issues which we have to think about is, you know, the staff risk of potentially contracting COVID, but the importance of delivering some education to students, you know, in person, so that students have that contact and it's a different learning experience. So how we blend that experience, you know, how we keep staff and students safe, and how we, you know, that there's a delicate balancing issue to you know, to how you get that right. And obviously, whilst, you know, a good proportion of what we do can be done from home with the right support, and as everyone's talked about, the right environment, you know, also an awful lot of what we do from a research perspective as a university is laboratory based. And obviously that has to be done in the laboratory. And again, we have to find safe ways of supporting staff to be able to carry on with as much work as possible under those circumstances. I mean, I think I would also echo Laura's point about boundaries, and I think certainly from a more personal reflection, I think the thing that I found hardest with it is that you've kind of got no boundary between home and work, and that is, I think that can be a little bit of a challenge with working from home. But I think what I hope will come of this at the end of COVID is that we'll have a slightly more balanced approach, that we might have an approach which is more flexible, allows people to work at home when they can, and, you know, that often reduces stress related to travel and as well as the carbon footprint. So but you know, at the same time, some in-person contact is going to be important for our students, it's going to be important for the cohesion, it's going to be important for boundaries. So I think hopefully we'll come up with we'll have a range of solutions to deal with the current crisis, but that will then lead us in a better position to have a sort of blended solution that gets the best of both worlds going forward.
Brilliant, thanks a lot, Clive. Ed,
Can I say something extra on that? Yeah, I was just going to say, I mean, I totally reinforce what Laura was saying, and the importance of boundaries, and also both in time and space. So it's making sure you've got clear space, you've got clear time, and also there's variety. The other problem with working at home is you can feel like you're spending your entire time sitting in front of the same screen. So actually doing different things is really important, so that you've got that variety and change. But I also wanted to pick up on the point of blended, because I think probably where we're going to end up at is some kind of blended working, where you've got a mixture of face-to-face in office and on site versus at home. And that's also quite interesting when we think about what we've been doing in mental health treatments for adult mental health, because traditionally our therapies, if we're doing a talking therapy with somebody, would be in the room with them face to face. Over the last few years, there's been increasing growth of online therapies, whether that's through a web or through a video conference like this. That has accelerated massively as a consequence of COVID. So a lot of the NHS psychological therapy services are now delivering treatments through phone or video conference. It looks like that's working just as well in terms of overall effects for patients. But what a lot of researchers have been looking at is a blended treatment model. So the idea is that you might get the most both impact for people and the most cost effective and the most accessible treatments. If you have a mixture of meeting people face to face, so you build a relationship, and then following things up online with the occasional face to face in the room, as it were, face to face to follow it up. So I think that's a space that I think we're probably going to be accelerating in the workforce in general, trying to get a feel for that. And I think a key point is that for different people, different blends are going to work. Some people are completely happy to do it all online. And some people, if you offer them a therapy that's online, they're really uncomfortable with it, because actually what they want is the physical space of somebody there with them. So I think we're going to have a blended model, but we're going to have space to be flexible in how it works for different people.
Yeah, thanks a lot, Ed. We're coming up to the end. I've got a question, and probably quite a difficult question here. Do we have a model or example of what is considered excellent or optimum mental health that we kind of gauge against? And also, is there an app for it? Or does the university and society at large even have a way to approach it? So Clive, I'm going to pick on you to start with that. Is there a kind of optimum level of mental health?
Well, I think it's a very good question, because I think what we've usually done is think of it more on the other way and think, are there problems that need to be solved? Are people having challenges with mental health, or is their well-being, less good than it could be? But I think there are also scales, one or two research scales at least, that focus on positive well-being and positive mental health, although that's been a much smaller kind of, area of research. I think we definitely see that what we want to focus on as a big part of what we're doing is maintaining well-being. And I think maintaining well-being is really important. And I think we would have a big focus on doing that. I think within that, obviously you want to promote positive well-being and positive sort of mental health. Although I think there's a little bit of a delicate boundary, because I think you don't want to kind of end up stigmatizing people because they haven't got positive well-being or positive mental health. And the reality for most people is that, most of us live in a position where it oscillates a little bit over time. And, there might be times that are more difficult, times when we're feeling really buoyant, times when we're in between. And I think we just want to, respond to well-being and that breadth of what's usual experience, try and help people stay within a well-being that's within that sort of range, promoting it as positively as we can, and hopefully, avoid or reduce the chances that that's going to tip into something that becomes a mental health concern. So it's probably a very waffly answer, but I think it's that, maintaining well-being certainly feels like a very important objective. Ed?
No worries. I think there's a couple of people to jump in. Laura, do you want to go first, and then we can take?
Yeah, just briefly. I mean, I think this also there's a huge literature on happiness as well. And if you're, it's totally in the eye of the beholder, and it differs by culture, country, age, whatever. There's an interesting app called Mappiness, and they've had some really good research coming out of it, where people track their happiness as to where they are, what they're doing, who they're with. And people can take a look at that, and you can track your own and see how it falls out if that's something that you're interested in. But I agree with what Clive said a lot.
Brilliant, thanks. And Ed?
Yeah, so I mean, one of the things that the app we're releasing does is something similar to that, though also gives strategies as well. I mean, I think there's a literature on flourishing, which is, so there's not just the absence of negative symptoms, there's the presence of positive symptoms. So you can build up. I think I'd be really cautious about saying there's an optimal mental health for several reasons. One, as Clive indicated, it's really dynamic. It's constantly changing. we're moving around in how we're feeling, what we're doing, and it's totally context dependent. So, you know, being happy in one situation, in some situations, is an inappropriate response, and in other situations, being sad or anxious is a normal and healthy response. I think where it gets stuck is where it becomes a problem, is if people get stuck and they can't move between them as is appropriate, and that's often where we get into the more serious conditions. So one of the things we're really interested in is looking at how we can reduce the processes that get people stuck. So worry or rumination or avoidance. And so I'd be careful about, I think there's things we can do to promote your well-being, but to say you can hit an optimal point, I mean, I'm a bit worried about getting into the, I'm a big fan of things are good enough rather than getting them perfect, because when people start getting perfectionism, or that it itself can be problematic. So there's a lot of nice literature now that says one of the reasons why some people aren't happy is because they're constantly trying to be happy. Right. You know, they've got these high expectations of what they should be in terms of being happy, which they then can't meet. So I think actually saying this is, I'm okay, I'm doing okay, this is good enough, is actually, and that comes back to the compassion again. I think that's a really important place to think about in terms of where we sit with our mental health.
Brilliant. Thank you. Rohit, did you have anything to add to that?
And I just thought, again, in a very sort of crude way, summarizing what's been said is basically, it's like living in the 100-acre wood. Winnie the Pooh, Eeyore, and Tigger and things. Each person has a personality. Tigger, if he becomes a bit depressed, you'd be a bit worried. That's not right for him. If Eeyore becomes too happy, that is worrying. So it's almost about our own internal thermometers and barometers and how we judge ourselves within our own settings. And any excesses either way, like I mentioned and Clive mentioned, would be a bit concerning.
Brilliant. Thank you. I love that analogy. Well, we've just overrun 2 minutes past 2. Thank you so much to everyone for joining us today. Thanks for all the questions. I've seen a lot of chat as well going on between people catching up with each other. So I hope you've enjoyed that. Thank you so much to our panelists who've joined us today. Really great. We'll be back with another one of these next month. We'll be doing them sort of every month for the next few months. And all the links that our panelists have mentioned, all the apps, all the resources, I will put those all in the follow-up email that comes out to everyone that's attended today so that you guys can read a bit more. So thank you very much.
Thank you, everyone.